Small, basic procedures are very easily accessed here in the United States, but over in other countries it is nearly impossible to get. Denny Bradley, a retired pharmacist, and his wife Judy went down to Guatemala to participate in a medical missions trip through the group Faith and Practice.
It's a trip where a group goes in with specific medical specialties to treat people in an area that doesn't have that kind of capability.
There were many different roles on the trip, and everyone had a specific part. Denny's role on the trip was focusing on the distribution of medications before and after the operations.
My role was as a pharmacist supporting the surgical team, doing pre-op medications, post-op meds, and discharge meds for the patients after they went through surgery.
While Denny was helping with the medical side of things, Judy was the documenter for the trip, and she was the one interacting with the people.
Being a documenter, and I documented things that happened on the trip.
Most of the 67 procedures done were surgeries that people in Guatemala do not normally have access to.
We basically did hernia repairs and cholecystectomies or gallbladders.
While both Denny and Judy had very different jobs on their trip, the favorite part of the trip was almost the exact same. They liked knowing that they helped heal people.
I think the things I think about when I think back is two patients in particular. The first year we went, there was a patient called Pablo, and he came in with a face that had a scar here where his lip and everything were cut apart. It had grown back together that way. He'd been in a motorcycle accident, and he was 23 years old and said, "I can't get a job looking like this."
People in first world countries take for granted the access to medical assistance that is available to us, while people in other countries are not as fortunate.